Good afternoon and welcome to our next webinar in our series entitled Let's Get Healthy in 2023. Our lifestyle medicine team has launched this series in order to provide education on the role of healthy lifestyle changes after a diagnosis of cancer. Today, we're in for a real treat. We're going to learn about tips for managing stress. This webinar is entitled Stress Busters. You can't get better than that. So it's my privilege to introduce our three amazing speakers. First, Dr. April Hirschberg is an adult psychiatrist who is also board certified in lifestyle medicine. She is certified by the MGH Benson Henry Institute for Mind-Body Medicine to deliver the Stress Management and Resiliency Training Program, also known as the SMART program. Since 2018, she has been leading stress management and resiliency programs for individuals with cancer, as well as those at increased risk for cancer. Since the onset of the COVID-19 pandemic, she has also been offering similar resiliency group programs to frontline healthcare workers. Her clinical interests include women's mental health, psycho-oncology, mind-body medicine, and lifestyle medicine. Next, we are fortunate to learn from Dr. Rachel Millstein, who is a clinical health psychologist with a background in public health. She's an assistant professor at Mass General Hospital and staff psychologist in the MGH Cancer Center's Lifestyle Medicine Clinic. Her research focuses on developing physical activity and diet interventions. Her clinical work includes the use of mind-body approaches and evidence-based strategies for managing depression, anxiety disorders, weight, health behaviors, and chronic health conditions. Finally, we are so fortunate to be joined by Lauren Winters, an adult oncology nurse practitioner who specializes in the care of persons with a diagnosis of breast cancer. She is also the Assistant Director of Breast Cancer Survivorship at the MGH Cancer Center in Waltham and Assistant Director of the MGH Lifestyle Medicine Program. She is a certified lifestyle medicine practitioner, as well as a health and well-being coach, a yoga instructor, and an Ayurvedic health counselor. This webinar will be recorded and there will be an opportunity to ask questions at the end of the presentation. Enjoy.
Thanks, Amy.
Great. I think we can start our slides. Thanks, Allie. Okay, we can go right ahead. Next slide, please. Well, hi, everyone. Welcome. We're so glad that you're all joining us today. Just by way of background, there are 6 pillars of lifestyle medicine. And so you can see the pillars here in our webinar series. So far, we've talked about a number of these, including physical activity, including healthy eating. And we would encourage you to check out our website at the Lifestyle Medicine Clinic of the Cancer Center in order to see the schedule and sign up for future webinars. Today, we're going to be focusing on this blue section here, developing strategies to manage stress. And we know that stress management, cultivating skills to do so, and the associated resilience that it can bring really can help improve our well-being and our overall health. Next slide, please. Okay, so just an overview of lifestyle medicine. How can it help people with cancer? Well, we know that it can improve quality of life. So incorporating physical activity, diet, stress management, social connections, reducing substances, etc. This can all also improve side effects from treatments. It can improve your physical functioning, mood, fatigue, and your overall cancer outcomes. So again, this is one piece of the puzzle today, but we do encourage you to explore these other aspects of lifestyle medicine if you haven't already. Next slide, please. Just a little bit of humor when we start talking about stress and our busy, busy minds. They really love to do things that, certainly help us, but also to think thoughts that aren't always as helpful or useful in the moment. So this little cartoon sums up a lot of the things that we all experience and that we'll be talking a little bit about today. Okay, I'll pass it off to April.
Thanks, Rachel. I love that slide. That previous slide, so funny. And we are going to talk a little bit about humor a little later in the talk. So that's a good precursor to it. And so it's been a real privilege to be here today and work with everyone on this call and bring this information to the people listening, because stress, as we all know it, is everywhere and it surrounds us really at all times. And it really, in the course of history, this is probably one of the most stressful times we can be living in, and certainly in our lifetimes. So it's important to talk about stress and know a little bit about it. So it seems a little silly to give you more information about stress because most people know what it is, but sometimes we have a hard time identifying it or knowing when it's happening, even when we're in the midst of it. So I just want to back up a tiny bit and just say that not all stress is bad stress. So stress is really, it's defined as any demand that we have as humans. So it's any demand or change. So for many people, a little bit of stress is okay. Like a little bit of stress got me to, look at these slides ahead of time, and a little bit of stress gets people to study for tests or get to appointments. A little bit of stress can be healthy, and it's usually like there's a curve, there's a whole definition of sort of healthy stress, and then what's called eustress, and then there's the chronic stress or severe stress, and that's when stress is really too much and sort of runs amok. So I'll just say this, for the sakes of today's talk, we're going to be talking about stress awareness in general. And one of the things that we know is that stress can come in many forms, and it can come as a result of a major life stress, like a cancer diagnosis, or, in your own life or a loved one's life. And it can also come in a somewhat positive event, like a move to a place you want to move, or a new job that you want, or any number of things. So it's, as I've said, any demand or change can be stressful. And sometimes it's the little stressors of everyday life, these tiny stressors of making sure you have groceries, and make sure you're shoveled out, make sure you have power. That's more of a larger stress. But there is these real-time stressors. And then there's also what's called remembered stress, or from the past, from stressful life events, or projected future stressors, looking out to the future. So as many of us have had, past stressful events can be relived or re-experienced. And a lot of people have worries about future events, and that can also be very stressful. So to make stress even worse, it's the perception that we can't cope with the stress that can make our experience of stress more difficult, and we can experience what's called distress, or feelings of anxiety or distress or worry as a result of the stress that's in our life. So it's the perception that we have a threat, which is the stressor, and that the perception that we can't cope, that can make things worse. So I think we'll go to the next slide, Allie, if that's okay. So this is also a kind of funny but sad picture, because sometimes this is titled like, I think I'm having stress for this for this animal. So sometimes we have stress that's so prominent that we might not even recognize it. So it's important, especially for each individual, to identify your own stress signals. For some people, it will be a physical sensation, like headache or stomach upset or nausea. Or for many people, it may be a feeling of stress, or that they can't cope, or a feeling of anxiety or worry. Or it could be a behavior, you're maybe a little bit impatient, or a little huffy with your loved ones, or something like that. So recognizing your own stress warning signals, and then building up your coping strategies, is going to be really, really important. And it's important to help get some coping strategies. And that's what we're going to do today. We're going to add some stress management tools to your toolkit. And hopefully one of the things that we bring to you today is going to be something you can utilize in the future. Again, we don't want you to have stress, but we do want you to be able to practice these opportunities. So maybe next slide, Allie. Okay, so first, a little more about stress and the stress response, this is a little bit of the sciencey part. And again, I love these images, and I know people might have seen this before if they heard the talk last year, because it was in that slide deck. But excuse me. So the stress response, our bodies, it is a survival mechanism that we have from an evolutionary standpoint. It's been around, and it's in animals and it's in humans. And it was first described that the stress response, or fight or flight, or another word of it's called the sympathetic nervous system. It's our nervous system, and that's it prepares us for fighting a potential predator, really, or fleeing from that. Sometimes people hear fight, flight, or freeze, but it was first described by Walter Cannon at Harvard Medical School many, many years ago in the early 1900s. So that's really the describing of the stress response. And the stress response is when our heart rate goes up, our blood pressure goes up, our respiration goes up, that's our breathing, and our muscle get tense in order to do all those things like preparing to fight or flee. And oftentimes, and if you've experienced the stress response, you'll know what also happens sometimes is our concentration goes and our memory goes a little bit, because all of our the nervous system is really focusing on our core essential components of that, the heart rate, the blood pressure, and all of that. So digestion kind of shuts down, and so does our ability to really think clearly. So so many of us, if not all of us, know what it is like to be in that stress response. So so why don't we go to the next slide? Because this is again, a kind of an unfortunate picture, because this is really where it shows how chronic stress, or stress that is very high level and sort of left unchecked, can really impact all of the major parts of our body. You'll see on that slide, there's impact for the central nervous system, and that's our brain and our spinal cords, and that's our muscles, basically. That the nervous system controls our muscles, and you can see many things are sort of go out the window, and our memory, our concentration, and the other area on that left side of the screen is the muscular system. A lot of people who have a lot of stress, you feel it in your neck, carrying tension there, or people have back issues. So then there's the autonomic nervous system, which is the one I mentioned in terms of the heart rate and blood pressure. Like, we don't control that consciously when we're in the stress response. That will just go up. And as I mentioned, as the heart rate, blood pressure, oxygen, everything is focused on the core parts of our body, our heart and lung, it sometimes goes away from the digestion. And many people will know that digestive issues occur when we're in the stress response. So I think we'll go to the next one. And then came along Dr. Herb Benson. Actually, there are many people that came along around the same time that were studying the body's stress response. And this was before we really knew in medicine that stress was contributing to so many conditions, health conditions. But Dr. Herb Benson was a cardiologist, and he and colleagues were studying the stress response in a lab at Harvard Medical School, basically the same place that the stress response had been described. And he was working on studying blood pressure and heart rate, and approached by some individuals who were transcendental meditators, and found that they could lower their blood pressure and their heart rate. And the story goes, he studied them and basically identified that the parasympathetic nervous system, which is the opposite of the stress response, which is the body's relaxation response. So, and he wrote this very famous book. I think this was in 1975, and it's had other editions, and he's written many other books, and he's been millions of copies of this book were sold and translated into multiple languages. So it's really quite exciting. And we can go to the next slide and I can tell you a little more about it. Because what he found was by having the ability to elicit the relaxation response, we are able to control our own blood pressure and our heart rate and our breathing rate and muscle tension. And we can lower all of those things and lower adrenaline and the stress hormones along with it, and increase our memory and concentration. So next slide, Allie, please. So what Dr. Benson really kind of summarized the relaxation response and coined that term was what was needed to elicit the relaxation response, to activate our relaxation response, that parasympathetic nervous system. And what he found by studying these transcendental meditators was that you needed a focusing tool, like a word or a phrase or your own breath, or it could be a sound, a prayer, a movement. And we're going to talk a little bit, we're going to do some examples and also do a movement later with Lauren, but it can be directed directed by someone else or self-directed. But in order to elicit the relaxation response for yourself, your body's own profound rest, basically you need to have a quiet, non-judging attitude for yourself. And it's basically having the opportunity to break the train of everyday thoughts, turn off that negative, maybe self-talk or all of the thoughts about all the to-do lists. And it gives you an opportunity to give your mind and body a break and elicit that relaxation response and have all those positive things that I just talked about. And although Dr. Benson recommended, anywhere from 10 to 20 minutes a day or more if possible, there are short exercises that you can do to elicit this relaxation response. So that's the good news. So we're going to try some of those, but we can go to the next one. And then Rachel, are you going to take over here?
All right.
Thank you.
Great. Thanks, April. All right. So we talked about the relaxation response, or the RR, and we are going to do some more in-depth activities, but just as a little kind of sampler of the connection between mind and body, I'm going to ask anyone who's comfortable, you're welcome to do this wherever you are. If it doesn't feel good in your hands, then certainly don't. But if you're able to, go ahead and make fists with your hands. And I want you to squeeze those fists as tight as you can and squeeze harder and notice what it feels like in your body right now as you hold that tension. Good. Now release. Think to yourself, what did you notice? What happened in your body when you made those fists? I think we're not going to do a Q&A on this, but I wonder how many people noticed that, first of all, you probably felt the tension in your hands, right? And did anybody notice anything about the way that your breath was flowing while you held that tension?
I held my breath, Rachel.
I did too, April.
And I've even done it before. I mean, I do this all the time, so I still do.
Right. It's pretty automatic. Not everyone, but most of us tend to hold our breaths when our bodies are tense. And similarly, when we hold our breaths, it can lead to tension in our body. So let's try that one more time. I'm going to ask you to try to make those fists again. Okay, so try to squeeze those fists, hold them tight as you can. Now try to breathe slowly and deeply. So inhale and exhale. Keep trying to hold those fists. Let's do it one more time. Inhale and exhale. Slow and long as you can, and release your hands. I'm wondering if anybody noticed a difference either in your fists or your body. So just think about that for a moment. So typically what occurs is that when we breathe deeply, when we use our breath to bring about that parasympathetic nervous system, that rest and digest nervous system that April was describing, it's much, much harder to hold our tension as tightly in our physical bodies. So this exercise is meant to illustrate that quick connection between our mind and our body, our breaths and our attention. So know that using our breath, that long, slow inhale, that long, slow exhale, it's a quick way to induce this relaxation response and begin to turn off the stress response, turn on that relaxation response. So why don't we move forward to the next slide? Okay, so resilience. I'm sure everyone is familiar with this term. It gets used a lot, kind of in common language and in the media. And it's something that certainly everyone is striving for, right? So the basic definition is resilience to bounce back in the face of stress or adversity. So picturing a tennis ball versus an egg, right? If you drop the egg, what happens? Crack. That's more of a brittle structure. If you drop that tennis ball, bounces back. So that's what we're all aiming for, is to have components of our lives where we feel like we are, or we can be more like the tennis ball. So our ability to adapt to adversity and restore equilibrium, whatever version of equilibrium is accessible to us at the time. So there's lots of ways that we can build resilience. Many of them, of course, are included in lifestyle medicine. So in these 6 pillars of lifestyle medicine, so things like our healthy lifestyle behaviors, right? These are things like eating our whole food, plant-based diet, our physical activity is, of course, a pillar of resilience, both our minds and our bodies. Maintaining positive and adaptive perspectives. So there's different sort of cognitive strategies that we may use to foster resilience, whether that's examining the content of our thoughts and understanding if they're fully realistic in that moment, and if they are, how do we create acceptance around the challenges and problem solve around the situations that we can make a difference, our behaviors can make a difference in that moment. Positive social functioning. So social support is a key aspect to resilience. And many people have seen, the TED Talk or read the new book that came out from one of our colleagues here at MGH and Harvard, which is to say that in a long longitudinal study, it's the quality of our relationships that tends to lead to highest quality of life. We talked about developing acceptance for the things that we can't change in this moment. Appreciation. Also really important to kind of consider our gratitude, right? And it can be very small, but we would encourage you each to try to consider the things that you're grateful for or appreciate on a regular, ideally daily basis. So it could be 3 good things that happened that day. It could be 1 good thing that happened that day, but it's a nice practice to be in that can really help our resilience. And then our energy boosters. So just knowing what it is that both drains our energy. You can think of your energy as a battery, and what deposits can go in to boost your energy, right? Is that physical activity? Is that talking with a friend? Is it, reading a book? You name it, but knowing what they are so that we can call on them in times of stress can help boost our resilience as well. Okay, next slide, please. All right, antidotes to stress. There are many of them. We've talked about many of them here just to review. And then we're actually going to go into a number of the practice exercises here. So we talked about, so we started to talk about mind-body practices. So this can really be a whole range of things. Meditation is one of those such mind-body practices. This is, again, with a kind of specific mental focus, focusing on the present moment, letting go of thoughts in a non-judgmental way. Yoga, again, we're lucky enough to have Lauren here, who's going to lead us in a yoga practice later today. Tai Chi can be helpful. Prayer, although as a note, for some people that is of a religious nature, for others it's not. It's a personal preference, but it can go in any direction that you may benefit from. And acupuncture, acupressure, these are also helpful mind-body practices for many people. When we talk about exercise as an antidote to stress, we want to, of course, emphasize aerobic, but also strength training, right? We never want to forget about both sides of that physical activity recommendation, particularly for cancer and cancer survivorship. Balancing nutrition. Again, we had a webinar on this very recently. It was wonderful. If you haven't watched it, go watch it. The idea being, of course, whole foods, kind of plant-based eating. Social support, we talked about this, social connectedness, sleep, right? So we all are familiar with what it feels like when we don't have good sleep, and hopefully familiar with what it feels like when we do. And sleep is such a foundation to our resilience and our ability to cope with stress and to bounce back from stress. So of course, if there's sleep challenges, we'd encourage you to ask your providers about ways to work around that. And then again, cultivating the positive emotions. We talked about gratitude. Optimism is extremely important for resilience, the feeling that we can cope with stressors and that we want to, right? That we looking to the future with hopefulness and optimism. And humor. We are going to talk about humor. Let's not forget how important it is to laugh, the best medicine, as they say. So let's move forward and we'll talk more about humor.
Thanks, Rachel. So one of the things that's great is to talk about fun things. It's important to talk about stress and the stress response and the resilience, but also these mind-body approaches that we're going to continue to discuss, but also some things that you don't really think of as being helpful buffers against stress. Because again, when someone's so stressed out, or we collectively are stressed, especially, like early on in the pandemic, it seemed like almost wrong to be laughing because there was so much suffering and stress around us. But over the course of history, and I actually gave a whole talk on humor and laughter, so I've shrunk it to one slide. But there is a robust history of how humor has been used throughout the millennia by a variety of different peoples, basically, so from indigenous people to the Greeks and all the way through history. So it wasn't until this century that we were able to begin to study humor in medicine and laughter in medicine. So that's why it kind of got dropped a little. I don't think a lot of us learned about it in our training, but I think it's coming back. And it's important to recognize that humor and its most visible and sort of recognizable expression, which is laughter, has been shown to scientifically actually have a lot of health benefits. And one researcher, William Fry, who actually got the first federal funding to study laughter, termed it internal jogging. And again, for those of us who sometimes aren't, maybe jogging outside, you can do some internal jogging inside and by watching funny shows. So I'll tell you, in terms of laughter's benefit, they're multiple. There's the increase in the if you laugh really hard, you have this forceful exhalation, and there's an improvement in your respiration, and there's improvement in your blood flow. There's some research that shows it's great for immune response as well as pain tolerance because of the endorphins that are released. And there's also some studies that show that the laughter does reduce stress hormones like cortisol. So that's all great news. And the other good news is that some of the studies show that you don't have to be laughing like out loud and hard, like I just mentioned. It's actually the frequency of the laughter that's important, not the intensity. So the good news is, however you're going to laugh is going to be good for you. And I would highly recommend you do it. And there's even something called laughter yoga. I didn't ask Lauren about that, but there is some research about that too, which is fun. because there's some studies that show you don't even have to be real laughing. You can fake laugh and still have some benefits. So it's all good news about humor and laughter. So I encourage people to watch funny shows or listening to funny clips if you can. And I always recommend, you brought up sleep, Rachel. I've recommended for years now, people stop watching the nightly news and watch a comedy. So that's my other stress tip. But I will go to the next slide, as Allie, if that's okay, because I wanted to just show this slide, and I know we're on almost target for time, Rachel, and I know we want to leave enough time for Lauren to do this, but I'm kind of toggling back and forth, because the good news is there's so many different ways to buffer against stress and ways in which to elicit your relaxation response that you might not always think of. This child here is sort of what we all think of maybe when we think of mind, body, or relaxation, because this individual is looking like engaging in the relaxation response by meditating or being very mindful. But you can do it by being out in nature. That little corner of the screen, you can be out in nature. There's a lot of studies that show that decreases stress. You can be physically active and moving, or you can be imagining yourself in another spot, like imagine a joyful place imagery. So there's tons of different ways. And then the center picture of this puppy has two meanings. I don't know if you wanted it to, Rachel, but it's the profound rest and importance of sleep that we need. But also there's a lot of research about pets and how they really add to our stress management. so being around pets and other animals, or just borrowing a pet, is good too. So I'm going to do a very brief exercise now, and we can leave this screen up. And it's just a very quick demonstration of how to elicit the relaxation response. It's called, remember I had mentioned with Dr. Benson's work, he kind of distilled down the relaxation response after studying it, and found that a repetition of a phrase could be something to break the train of everyday thought and give our brain that break, that relaxation response. For many people, it's focusing on the breath, the in-breath and the out-breath. And one of the things, we're going to just try it, and Rachel showed the quick body-mind connection, but this is one where we're going to try to do a single pointed focus meditation. And that's based on a phrase. And the phrase is just this. And for some of you who are listening to this, you might never have tried meditation or mindfulness, or it sounds a little bit too out there. So this is a just brief introduction to what it's like, and to see if you might want to try it and learn to elicit your own relaxation response. In addition to these other ways, this is another nice way. So what I'm going to invite people to do, you don't have to close your eyes. That's another common sort of misconception. You don't have to close your eyes to practice relaxation response exercises. You can do we didn't talk about diaphragmatic breathing, but deep breathing is a way, taking deep breaths to engage the relaxation response. And then this next exercise that I'll show you. But if you've done this before and you want to close your eyes, you certainly can, or you can leave your eyes open and maintain a downward kind of focus. So you're not, focusing on multiple things, but just maybe focusing on your hands in your lap or something like that. So we're just going to do this for a couple of moments, and this is the opportunity to engage your relaxation response. So what I'm going to invite you to do is go ahead and uncross your arms and legs, and as you're doing this, begin to focus on your breath. Notice you're breathing in as you're breathing in, and notice you're breathing out as you're breathing out. Breathing in, you can focus on the word just. Breathing out, you can focus on the word this. So you're focusing on the phrase just and this. Breathing in, just. Breathing out, this. If other thoughts come to mind, that's okay. Just return to your focus. Just on the in-breath, and this on the out-breath. Just this. just in this. We'll just take another moment or two here. We'll take a few final breaths with a focus on just on the in-breath, and this on the out-breath. Breathing in, just. Breathing out, this. And next, I'll invite you to take one last breath, and then you can go ahead and open your eyes. And sometimes if they've been closed, it's easy to kind of imagine what your environment is before you open your eyes again. But you can go ahead and open your eyes, and hopefully for some of you, that was the briefest introduction to what it means to elicit the relaxation response and kind of demystify a little bit what meditation might be, because it doesn't have to be looking like this child, very serene. It can be sitting amongst unfolded laundry, wherever you are. It can be many things, but it's just the elicitation of that time of the day to let go of the everyday thoughts and just focus on one thing in the present moment. And for many, it's the breath, or it could be the phrase. So I'll pass it off at this point I think we're passing it off to Lauren at this point. Am I correct?
Yep.
Yeah. Okay,
You
good.
are.
Thanks, Lauren.
Thanks.
Sorry, ran a little over.
Thanks, April. You're perfect. That was so wonderful, and a wonderful segue into a continued conversation about meditation. And again, I hope that practice really demystified meditation, because it is so simple, right? That simply connecting our thoughts, our attention and our focus to the present moment is really the essence of meditation. So thank you for that. It's such a great tool to have in the back pocket, just this. So just to comment a little bit on the health benefits of meditation, now that we know a little bit more about it. As April mentioned and Rachel has mentioned, that meditation practice in its many forms that exist does activate that parasympathetic nervous system, aka the rest and digest, aka the relaxation response. And interestingly, it's been shown to assist with many different sort of symptoms and potentially medical problems. Many of the studies have been fairly small sample size and not randomized controlled trials, but are all very promising. But probably the bulk of the research to date has been around meditation for depression, anxiety. Oh yeah, Allie, would you mind advancing the slide? Thanks. There we go. Depression, anxiety, and chronic pain. And this I thought was very interesting. Additionally, around the research that supports how meditation might work, because we've found, or research has found, that meditation can actually change the brain, particularly in this area of the brain called the amygdala, which is sort of our center of emotions, and make it less reactive. So in sort of the years between 2014 and 2019, and probably ongoing, a researcher at MGH by the name of Dr. Desbordes, Gail Desbordes, who's a neuroscience and radiologist, has been using functional MRI, which is a type of brain scan, to assess changes of the brain in meditation. And what they found was in a population of depressed patients that an 8-week meditation intervention, once they did pre and post brain scans, show that this area, this amygdala area, the center of emotions, was actually smaller and less reactive in those patients. And what they think the the reasoning for that was, or how this was sort of helpful for them, was that those patients who learned to meditate actually became more connected with their bodies in the moment and less connected with their rumination or sort of obsession with negative thinking. So they actually learned to retrain their brain and, in effect, change the actual size of a structure in their brain. I just find that absolutely fascinating. So we know that meditation additionally, and this is through Dr. Benson's research, lowers heart rate, blood pressure, it releases physical tension, and of course can improve sleep quality. So these are all great reasons to try meditation. Next slide, please, Allie. And again, there's no one way to do things. There's many different kinds. Luckily, meditation is simple and inexpensive. There's guided, there's unguided, there's mantra meditation where you are using like just this phrase or word or phrase that you repeat. There's mindfulness meditation, which is really, again, that attentive focus. And that can take many forms. Transcendental, which is where you're actually issued a mantra. You don't get to pick it, but your teacher picks it for you, and then you meditate on that. There's walking meditation, there's forest bathing, there's Qigong and Tai Chi, which are movement-based meditative practices. And then, of course, there's yoga. So we're going to talk about yoga in a bit and get to do some practice. But I did want to mention that some of the aspects that make for meditation are simply having a quiet space with limited distractions. So while maybe it's possible to meditate in a crowded, busy room, it's a lot easier if it's quiet in your space, right? Having a comfortable posture is also very helpful. So whether you're sitting, standing, or lying down, you just want to make sure you're comfortable. Again, having a focus of attention, whether that's cues from your instructor or whether it's a mantra or a candle that's lit, but having that way to help redirect your thoughts back to the present moment is a very helpful tool. We use quiet breathing typically in meditation, so it shouldn't be forced. And then finally, having an open attitude, and I remember Rachel mentioning that before, just being open to whatever comes from that experience. So, Allie, I'm going to ask you to take the slides down or turn them off or whatever, because we don't need the slides for this next part. We're going to lead you through a chair meditation. As Amy mentioned in my bio, I am a yoga teacher. I typically do standing up, sort of flowing sort of yoga practice, but I really do appreciate the option to do chair yoga for you all. You are welcome, however, to do any and all of this standing up if you'd like to stand up. So just keep that in mind if you're at home. So to begin our practice together today, I'm going to ask you to, if you are sitting in your seat, to sit on the edge of the seat so that your sitting bones are well supported, but so that your feet, the soles of your feet, are connected securely to the floor. Okay, so you can have your shoes on or off. It's completely up to you. Preferably you're not in some tight, high heel type of shoe, because I want you to be able to move your toes freely. All right, so take a moment to get settled in your chair. And then you can place your hands in your lap, allow your fingers to be soft. And you're welcome to lower your gaze. If you don't want to look directly at the screen, you can even close your eyes. That's up to you. And just begin to elongate your spine by lengthening up through the crown of your head towards the ceiling, while you can still feel your feet sitting, pressing to the ground, and your sitting bones on your seat beneath you. So it's that rooting down and lengthening up action. Get into a comfortable posture. And as you soften your gaze, allow the hinges of your jaw to release, any tension between the eyes. And now begin to turn your attention to your breath. starts in the center of your chest, perhaps, as you feel the breastbone or the sternum bone rise, right? And the ribs expand with your in-breath. And then as you exhale, feel your shoulders drop and your chest cavity empty. Right? It's just a gentle, rhythmic type of breath. Allowing an easy flow in and out of your nostrils. If it's also fine, exhale out your mouth if you feel too much resistance going on in your nose. And if any thoughts interrupt this attention on your breath and on your body, just notice the thoughts and allow it to move on. Each time coming back to your breath or any sensations of the breath in your body. And then we'll just begin the movement practice. Start by lifting both hands. We're going to rotate our wrists out and in, like in circles, out and in. And then we're going to change to the inward direction. And if you started one way, you can just go the other way. And get a good rotation going. Then we're going to open the fingers wide and then squeeze, kind of like we did before. Big breath in, open wide. And exhale on the squeeze. Good. And then we're going to make looser fists, so you're not clutching, you're just gentle fists here. And imagine you're holding on to the handlebars of a nice Harley. And we're just going to go up and down a few times, so just stretching out the front and back wrists. I'm always surprised at how much tension I've got in the wrists and the forearms, right? Yeah. And then just shake out your hands. Shake them out. Let it all go. Like if there's any of those disruptive thoughts, let them out through the fingers. Yeah, like those leopard spots falling to the ground. And then take your hands back to your thighs. You can let them rest there. We'll just roll the shoulders up and back a few times. It's nice to connect again the breath with movement. So breathing in as you roll up, breathing out as you roll down. You can go at your own pace here, and then we'll just switch directions. Forward a few times, like stretching out the upper back. Hold a lot of tension between the shoulder blades, right? And then just front and back a few times, shake them out. Nice. And then we're just going to take your hands and place them on, if you have, hopefully you have a surface in front of you, like a desk or a table or whatever, coffee table, something like that. And just place them down shoulder width or wider, might feel nice. And you're just going to, if you have a wheelie chair like me, push it back. Otherwise, you can just scoot back and come off the chair. And you're just going to be drawing the hips back away from your hands, which are remaining on that surface in front of you. You're just going to drop the head, let it go. And then maybe shake out the head from side to side, turning your chin towards one arm, then the other. And then to lengthen out the spine any degrees further, you can try tilting your tailbone back, and you'll feel your spine straighten out a bit more. Take some round out of the back, gives you a nice stretch in the lower back. If it doesn't, then don't do that. Right? One more cycle of breath, nice and long from end to end, so like a down dog at the desk. And then inhale to come back in. All right. Back to our upright position. So now I'm going to take the right hand and just grab the side of your chair, easy enough. And then on your next in-breath, raise the left arm out to the side. And long, exhale out, release any tension, and then we'll breathe in, taking this arm up and over, making a C curve with our body from our hips to our fingertips. Right? And just enjoy the side stretch here. You're going to take it to your degree, meaning what's comfortable for you. And then exhale, take that arm back down and place the left hand to the chair. We'll take the right arm out to the side to begin, and then on the next in-breath, bring the arm up and over. Nice C stretch. And just explore like the stretch for you. Like, what's your experience in this pose? What's going on? How does it feel? Where's the breath? And then come back out and let the arm come back down. Nice. All right, so from here, we'll take a very gentle twist here. Right arm's gonna come forward and up, little stretch in, inhale, and then as you exhale, you take your hand down to the left knee. Okay, it's gonna look opposite for you because we're sort of mirroring each other. So even if you go the other side, it's totally fine. Your other hand can grab the chair behind you, like maybe if you can reach under the seat, or if you want to reach the side of the chair, it's going to look different depending on what kind of chair you have. But as you breathe in, as we did before, take the crown of the head towards the ceiling. And as you exhale, just a gentle rinse. So we're definitely not cranking here. We're turning from the center of our chest a little bit to the side and just stretching out those back muscles. Okay, very gentle twist. Keep the low belly, the belly button, hugged in, and that helps support the lower back, a little more stability. And then as you breathe out, come back to center. And then we're just going to do the other side. So again, grabbing the chair with the opposite hand, the left arm's going to come up, get nice and long. And then as you breathe out, you're coming into the twist. Again, no cranking allowed. Take the hand to the knee. And then from here, from this sternum bone, the breastplate, that's where you're going to turn from, not from your lower back. That's nice and stable with your belly hugged in. You're going to go as gently as your body needs to go, right? And then come back through on the exhale, back to the center. Nice. Good, good, good. We're going to turn the focus to the lower body. So you're not going to see me very well. I tried to play with my camera to get my lower body in this thing, but it's fine. We're just going to listen and do in our own bodies. So we're going to start with both feet pressed firmly to the floor again if they've moved, and then just come up onto the balls of your feet. So you're going to lift your heels, and then we're going to swap heels down, toes up. Press down through the balls of your feet, heels down, toes up. And when the toes come up, give them a wiggle. Give them a little stretch. Nice. And then from here, we're going to take the left foot and keep it planted. And we're just going to lift the right foot off the floor. You can straighten out the leg. Like this, I tried to show, I would have to sit on that dust over there. So you have your left foot up, your right leg straight, and we're just going to take some ankle rolls. Ankle rolls. One direction, and then we'll switch directions. You're going to take it on good faith that you're doing it. And then we're going to take that right leg back down and just switch to the other side. So left foot comes up, it floats up, using your strong leg muscles to keep it there, and then just rotating that ankle around in one direction, and then the other direction. Yeah. Feels good. Okay. From here, we're going to bring the right knee in towards your chest and just round the spine a little bit. So just sort of lifting up the knee, rounding the spine, taking the gaze down to the knee or the foot, and then releasing that. Same thing, other side. This gives a nice little hip stretch. Knees up, head down, back's rounded. And then release that side. And then for our sort of pinnacle pose, we've got a chair warrior pose. So I am going to try and scoot back as best I can for this one so you can see me. That's pretty good. So I'm in my chair. This one is wheelie, so it might move around. We're going to try to keep it stable. I'm going to take my right leg out to the side. My left knee, this is tricky in a dress, but my left knee is going to come to the center, okay? This is one version of the warrior pose without having to move a whole lot. Take it another level if you'd like in the chair. You're going to step that left foot back. My toes are pointing towards the front, so pointing forward. Back foot planted, toes pointing ahead of you. So then, again, pressing into the front foot, pressing into the back foot. You can take the arms out to the side for your warrior. Feel free to gaze out over your front fingers. Give them a little wiggle. Good, breathing freely, smoothly, and then release. So we're going to take the left leg back and then do the other side. So another option, I'm going to go sort of one more level up. If you want to and you feel comfortable taking that left leg out to the side, again, you're here doing your warrior. Get a nice stretch along the inner thigh. or taking that leg out to the side for that version, okay, on the chair. Or if you want to lift off the chair and you feel steady, you're on that back foot, you're on that front foot, toes are pointed straight forward on that back leg, arms out to the side, gazing out over those front fingers. Again, breathing freely, filling the air in your lungs, exhaling out, lots of tension, releasing from the shoulders, and lower down the arms. Coming back leg first, then the front leg, going back to your upright chair. Last pose, we'll take hands to both sides of the chair. So kind of holding on. Press down through the heels. And again, lifting up through the breastbone. We're going to lead from there. As you inhale, you're gently coming into a back bend. So I'm going to turn so you guys can see this. I'm going from here, which is neutral, to a gentle back bend, and then roll the shoulder heads back a little bit more. Nice spread across the chest. Gaze can go up, and then exhale, let go. We'll do that one more time. Lifting up the breastbone, rolling the shoulders back. And then let go. Come back to a neutral spine. Again, a neutral spine is the one where the crown of the head is floating up towards the ceiling without too much tension in the back or the shoulder muscles. Once you come back to where we began, place your hands back in your lap, soften your gaze or close your eyes. Feel a lot of, hopefully, some energy that's moving throughout your body. In yoga, we call that prana, life force energy. Feel it moving through all your limbs, belly, chest, maybe even your head. And take one hand to the center of your chest and place the other one right on top. The light within me salutes the light within you. And this is the meaning of the phrase namaste. Namaste. Thank you, everybody. I think I'm right at time, but I'm still glad we did it.
That was great, Lauren.
And,
Thank you so
again,
much.
Wonderful.
my pleasure. It's a lot of fun.
That was really great. It's so nice to have that chance to relax in the middle of the day and learn from all of you. What a great webinar. We realize we're almost at noon, but if anyone wants to put a question in the Q&A box at the bottom of your screen, we're welcome to stay on for 1 or 2 more minutes to address any burning questions. I do want to put in a plug that in 2 weeks, which is March 29th, we have our next webinar, which will be focused at another key pillar of lifestyle medicine, which is social connections. And the title of that webinar is You Are Not Alone, The Importance of Social Connections. And Lauren Winters will be presenting at that webinar along with one of our social workers, Nova Hodge, and another nurse practitioner, Ugna Knight, and I might be mispronouncing her last name, so I apologize. I'll get it by next time. But I know that's going to be a really great webinar, Lauren. We really look forward to that too. So, but this was really great. Thank you all for teaching us about tips to manage stress. Thank you.